50 Clinical Judgment Nclex Questions, Nclex Practice Questions. Introduction. Welcome back to another Nclex practice session. Today's video features 50 Clinical Judgment Nclex questions designed to strengthen your ability to recognize patient cues, prioritize care, make sound nursing decisions, and evaluate outcomes. Clinical judgment is one of the most tested skills on the next generation Nclex, so practice thinking like a nurse rather than simply memorizing facts. Let's get started. Question 1. A nurse begins a shift and receives reports on 4 patients. Which patient should the nurse assess first? A. A postoperative client reporting pain of 7/10 after receiving pain medication 20 minutes ago. B. A client with COPD whose oxygen saturation has dropped from 95% to 88% on their usual oxygen. C. A diabetic client waiting for breakfast before receiving scheduled insulin. D. A client scheduled for discharge who needs teaching about medications. Correct answer. B. A client with COPD whose oxygen saturation has dropped from 95% to 88% on their usual oxygen. Rationale: a sudden decrease in oxygen saturation indicates impaired oxygenation that requires immediate assessment. Airway and breathing problems are the highest priority. Strategy: compare which patient has the greatest risk of deterioration. Address life-threatening respiratory problems before pain, teaching, or routine care. Question 2. A nurse notices that a hospitalized patient suddenly becomes restless, anxious, and confused after surgery. The patient's oxygen saturation has decreased from 98% to 90%. What is the nurse's priority action? A. Notify the healthcare provider. B. Increase oxygen and assess the patient's airway and breathing. C. Administer pain medication. D. Document the findings. Correct answer. B. Increase oxygen and assess the patient's airway and breathing. Rationale: restlessness and confusion are early signs of hypoxia. Improving oxygenation should occur before notifying the provider. Strategy: stabilize the patient before making phone calls. Immediate nursing interventions come first whenever possible. Question 3. A nurse is caring for a client receiving 4 potassium. The client reports burning at the 4 site, and the nurse notices redness and swelling. What should the nurse do first? A. Slow the infusion. B. Stop the infusion. C. Apply a warm compress. D. Continue monitoring. Correct answer. B. Stop the infusion. Rationale: redness, swelling, and burning suggest 4 infiltration or irritation. Continuing the infusion can worsen tissue damage. Strategy: remove the source of harm before treating the complication. Always assess 4 sites when patients report discomfort. Question 4. A nurse is reviewing laboratory results on 4 patients. Which finding requires immediate follow-up? A. Sodium 136 milliequivalent/L. B. Potassium 2.8 milliequivalent/L. C. Hemoglobin 12G/DL. D. Platelets 220,000/mm superscript 3. Correct answer. B. Potassium 2.8 milliequivalent/L. Rationale: severe hypokalemia increases the risk of life-threatening cardiac dysrhythmias. This abnormal value requires prompt intervention. Strategy: recognize laboratory values that threaten heart or brain function. Electrolyte abnormalities often require urgent attention. Question 5. A patient receiving morphine becomes difficult to awaken. Respirations decrease to 8 breaths per minute. What should the nurse do first? A. Shake the patient repeatedly. B. Stop the opioid and prepare to administer naloxone. C. Give another dose for pain. D. Encourage deep breathing only. Correct answer. B. Stop the opioid and prepare to administer naloxone. Rationale: respiratory depression is a serious adverse effect of opioids. Reversal medication may be needed immediately. Strategy: identify medication complications that threaten breathing. Treat the cause while supporting the patient's airway. Question 6. A client with heart failure develops sudden shortness of breath while lying flat. Crackles are heard in both lungs. Which intervention should the nurse perform first? A. Raise the head of the bed. B. Encourage oral fluids. C. Place the client flat. D. Give breakfast. Correct answer. A. Raise the head of the bed. Rationale: sitting the client upright decreases venous return and improves lung expansion. This helps relieve respiratory distress quickly. Strategy: positioning is often the fastest nursing intervention for breathing difficulties. Improve oxygenation before completing other tasks. Question 7. A nurse is caring for a patient whose blood glucose is 48 mg per deciliter. The patient is awake, alert, and able to swallow safely. What should the nurse do first? A. Administer 4 insulin. B. Give 15 grams of fast-acting carbohydrates. C. Notify the healthcare provider. D. Recheck the blood sugar in 2 hours. Correct answer. B. Give 15 grams of fast-acting carbohydrates. Rationale: conscious patients with hypoglycemia should receive fast-acting carbohydrates immediately. Delayed treatment can lead to loss of consciousness. Strategy: match the intervention to the patient's condition. If the patient can swallow safely, oral glucose is appropriate. Question 8. A nurse observes a patient suddenly pulling at the chest and saying, "I can't breathe." The trachea appears shifted to one side after chest trauma. Which complication should the nurse suspect? A. Asthma attack. B. Tension pneumothorax. C. Pulmonary edema. D. Heart failure. Correct answer. B. Tension pneumothorax. Rationale: tracheal deviation with severe respiratory distress is a classic sign of tension pneumothorax. Immediate treatment is necessary to prevent cardiovascular collapse. Strategy: recognize emergency assessment findings. Sudden breathing difficulty after chest trauma requires rapid action. Question 9. A patient with sepsis suddenly develops a blood pressure of 82/48 mmHg despite receiving 4 fluids. What should the nurse anticipate next? A. Vasopressor therapy. B. Oral antibiotics. C. Fluid restriction. D. Discharge planning. Correct answer. A. Vasopressor therapy. Rationale: persistent hypotension after adequate fluid resuscitation often requires vasopressors. Maintaining organ perfusion is essential. Strategy: follow the progression of shock treatment. Patients who remain hypotensive after fluids usually need stronger circulatory support. Question 10. A nurse reassesses a client 30 minutes after administering a bronchodilator. The respiratory rate decreases from 30 to 20 breaths per minute, oxygen saturation increases from 89% to 96%, and wheezing has diminished. Which conclusion is most appropriate? A. The medication was ineffective. B. The patient's condition has improved. C. The client needs emergency intubation. D. The treatment should be stopped permanently. Correct answer. B. The patient's condition has improved. Rationale: improved oxygen saturation, decreased respiratory rate, and reduced wheezing indicate that the bronchodilator is working. These findings show an effective response to treatment. Strategy: evaluate whether interventions achieved the expected outcome. Compare the patient's condition before and after treatment to determine effectiveness. Question 11. A nurse is caring for a client who is 1 day postoperative following abdominal surgery. During assessment, the client reports sudden shortness of breath, sharp chest pain, and feelings of anxiety. The oxygen saturation has dropped from 97% to 89%, and the heart rate is 122 beats/min. What should the nurse do first? A. Encourage the client to cough and deep breathe. B. Apply oxygen and assess the client's airway and breathing. C. Assist the client to ambulate. D. Offer pain medication for the chest discomfort. Correct answer. B. Apply oxygen and assess the client's airway and breathing. Rationale: the client's symptoms suggest a possible pulmonary embolism, which is a life-threatening emergency. Oxygenation and respiratory assessment are the immediate priorities. Strategy: focus on stabilizing the patient before carrying out additional interventions. New respiratory symptoms after surgery require rapid assessment. Question 12. A nurse is reviewing assessment findings for 4 clients. Which client should the nurse see first? A. A client with pneumonia whose temperature is 38.2 degrees Celsius 100.8 degrees Fahrenheit. B. A client with heart failure who suddenly develops pink, frothy sputum. C. A client with diabetes requesting a bedtime snack. D. A client recovering from surgery who rates pain as 6 out of 10. Correct answer. B. A client with heart failure who suddenly develops pink, frothy sputum. Rationale: pink, frothy sputum is a sign of acute pulmonary edema and requires immediate intervention. Delayed treatment can quickly lead to respiratory failure. Strategy: identify unexpected findings that signal rapid deterioration. Prioritize clients with airway or breathing emergencies. Question 13. A client receiving a blood transfusion suddenly reports chills, lower back pain, and difficulty breathing 15 minutes after the transfusion begins. What is the nurse's priority action? A. Slow the transfusion rate. B. Stop the transfusion immediately. C. Continue monitoring the client. D. Give acetaminophen. Correct answer. B. Stop the transfusion immediately. Rationale: these findings suggest an acute transfusion reaction. Stopping the transfusion prevents additional incompatible blood from entering the circulation. Strategy: recognize serious complications during treatments. Remove the cause of harm before completing additional interventions. Question 14. A nurse is caring for a client with bacterial meningitis. The client suddenly becomes difficult to arouse and has a blood pressure of 180/90 mmHg with a heart rate of 50 beats/min. Which complication should the nurse suspect? A. Hypoglycemia. B. Increased intracranial pressure. C. Dehydration. D. Anxiety. Correct answer. B. Increased intracranial pressure. Rationale: decreased consciousness, hypertension, and bradycardia are signs of increasing intracranial pressure. Immediate intervention is necessary to prevent brain injury. Strategy: connect assessment findings to serious complications. Neurological changes should never be ignored. Question 15. A nurse is caring for a client receiving insulin therapy. Before lunch, the client's blood glucose is 62 mg per deciliter, and the client reports feeling shaky and sweaty. What should the nurse do first? A. Administer the scheduled insulin. B. Give 15 grams of fast-acting carbohydrates. C. Encourage the client to exercise. D. Notify the provider before intervening. Correct answer. B. Give 15 grams of fast-acting carbohydrates. Rationale: the client is experiencing symptomatic hypoglycemia that requires immediate treatment. Correcting the low blood glucose is the priority. Strategy: treat urgent problems before completing scheduled treatments. Reassess after the intervention to determine effectiveness. Question 16. A nurse enters a client's room and finds the client lying on the floor after attempting to walk to the bathroom. What is the nurse's first action? A. Help the client back into bed. B. Assess the client for injuries. C. Complete an incident report. D. Notify the healthcare provider. Correct answer. B. Assess the client for injuries. Rationale: the client's condition must be evaluated before movement or reporting. Assessment determines whether emergency care is needed. Strategy: always assess before acting whenever a client's status changes. Documentation follows patient care. Question 17. A client with chronic kidney disease has a potassium level of 6.7 milliequivalent/L and reports muscle weakness. Which provider prescription should the nurse anticipate? A. Potassium supplements. B. Sodium polystyrene sulfonate or another potassium-lowering treatment. C. High potassium foods. D. Lactated ringer solution with potassium. Correct answer. B. Sodium polystyrene sulfonate or another potassium-lowering treatment. Rationale: severe hyperkalemia can cause life-threatening cardiac dysrhythmias. Treatment is needed to reduce potassium quickly. Strategy: recognize electrolyte abnormalities that threaten cardiac function. Anticipate interventions that correct the underlying problem. Question 18. A nurse is reassessing a client receiving oxygen therapy for pneumonia. Which finding indicates the treatment has been effective? A. Oxygen saturation increased from 88% to 95%. B. Respiratory rate increased from 20 to 34 breaths/min. C. Increasing confusion. D. Bluish discoloration of the lips. Correct answer. A. Oxygen saturation increased from 88% to 95%. Rationale: improved oxygen saturation indicates better oxygen exchange and response to therapy. The remaining findings suggest worsening respiratory status. Strategy: compare the client's status before and after treatment. Improvement in objective findings usually indicates effective care. Question 19. A nurse is caring for a client admitted with gastrointestinal bleeding. Which assessment finding requires immediate intervention? A. Blood pressure 84/50 mm of mercury. B. Mild nausea. C. Poor appetite. D. Black stool reported yesterday. Correct answer. A. Blood pressure 84/50 mm of mercury. Rationale: severe hypotension suggests significant blood loss and poor tissue perfusion. The client is at risk for hypovolemic shock. Strategy: prioritize signs of circulatory instability. Low blood pressure in a bleeding client requires urgent action. Question 20. A client with asthma has received a nebulizer treatment. 30 minutes later, the client states breathing is easier, lung sounds are clear, and oxygen saturation has increased to 98%. Which conclusion should the nurse make? A. The client requires emergency intubation. B. The intervention was effective. C. Another nebulizer treatment should be given immediately. D. The medication caused respiratory depression. Correct answer. B. The intervention was effective. Rationale: improved breathing, clear lung sounds, and normal oxygen saturation demonstrate successful treatment. These findings show that airway obstruction has decreased. Strategy: evaluate whether expected outcomes have been achieved. Positive assessment changes indicate that current interventions are working. Question 21. A nurse is caring for a client admitted with suspected stroke. The client suddenly develops slurred speech and weakness in the right arm. What is the nurse's priority action? A. Assist the client to the bathroom. B. Activate the stroke protocol and assess the time symptoms began. C. Give oral fluids. D. Allow the client to rest. Correct answer. B. Activate the stroke protocol and assess the time symptoms began. Rationale: early recognition and treatment improve outcomes in acute stroke. Determining symptom onset is essential for treatment decisions. Strategy: time-sensitive emergencies require immediate action. Rapid assessment can greatly affect the client's prognosis. Question 22. A nurse notices that a client's urinary catheter has stopped draining. The client complains of severe lower abdominal discomfort, and the bladder appears distended. What should the nurse do first? A. Assess the catheter for kinks or obstruction. B. Remove the catheter immediately. C. Administer pain medication. D. Encourage increased oral fluids. Correct answer. A. Assess the catheter for kinks or obstruction. Rationale: a blocked catheter is the most likely cause of bladder distension. Identifying the problem allows prompt correction. Strategy: investigate the simplest and most likely cause before performing more invasive actions. Assessment guides intervention. Question 23. A client receiving heparin therapy develops bleeding gums and blood in the urine. Which action is most appropriate? A. Continue the medication. B. Hold the medication and notify the provider. C. Encourage vigorous toothbrushing. D. Increase the heparin dose. Correct answer. B. Hold the medication and notify the provider. Rationale: bleeding is a serious sign of excessive anticoagulation. The medication should be withheld until further evaluation. Strategy: monitor for adverse medication effects. Significant bleeding requires prompt intervention. Question 24. A nurse is caring for a client with severe dehydration. Which assessment finding indicates improvement after 4 fluid therapy? A. Urine output increases to 40 milliliters per hour. B. Heart rate increases to 130 beats/min. C. Skin becomes cool and clammy. D. Blood pressure decreases further. Correct answer. A. Urine output increases to 40 milliliters per hour. Rationale: adequate urine output indicates improved kidney perfusion and fluid balance. This is a positive response to treatment. Strategy: look for objective evidence that body systems are recovering. Improved organ function often reflects successful therapy. Question 25. A nurse is caring for a client experiencing anaphylaxis after receiving an antibiotic. Which medication should the nurse anticipate administering first? A. Epinephrine. B. Acetaminophen. C. Furosemide. D. Insulin. Correct answer. A. Epinephrine. Rationale: epinephrine rapidly reverses airway swelling and improves circulation during anaphylaxis. Early administration is life-saving. Strategy: recognize medications used for life-threatening emergencies. Immediate treatment can prevent respiratory collapse. Question 26. A client with heart failure gains 2.7 kilograms 6 pounds in 3 days and reports increasing shortness of breath. Which finding is the nurse most concerned about? A. Fluid volume excess. B. Improved nutrition. C. Increased muscle mass. D. Constipation. Correct answer. A. Fluid volume excess. Rationale: rapid weight gain and worsening dyspnea indicate fluid retention. This can lead to worsening heart failure. Strategy: connect assessment findings with disease progression. Sudden weight gain often reflects fluid accumulation. Question 27. A nurse is assessing a postoperative client who suddenly becomes confused and restless. Oxygen saturation is 87%. What should the nurse suspect first? A. Hypoxia. B. Depression. C. Hunger. D. Fatigue. Correct answer. A. Hypoxia. Rationale: confusion and restlessness are early signs of inadequate oxygenation. Low oxygen saturation supports this finding. Strategy: always consider oxygenation first when mental status changes occur suddenly. Respiratory problems can present with neurological symptoms. Question 28. A nurse evaluates a client after administering a diuretic. Which finding shows the medication has been effective? A. Decreased peripheral edema. B. Increased crackles. C. Weight gain. D. Reduced urine output. Correct answer. A. Decreased peripheral edema. Rationale: reduced edema indicates excess fluid has been removed successfully. This is an expected therapeutic response. Strategy: evaluate medication effectiveness by comparing expected outcomes with assessment findings. Improvement confirms the treatment is working. Question 29. A client reports crushing chest pain that radiates to the left arm and jaw and rates the pain 10 out of 10. What is the nurse's priority action? A. Obtain vital signs, apply oxygen as indicated, and notify the rapid response or provider. B. Encourage the client to rest for 1 hour. C. Offer a meal. D. Prepare the client for discharge. Correct answer. A. Obtain vital signs, apply oxygen as indicated, and notify the rapid response or provider. Rationale. The symptoms suggest an acute myocardial infarction requiring immediate assessment and treatment. Rapid intervention reduces heart muscle damage. Strategy. Recognize classic signs of cardiac emergencies. Prioritize interventions that support circulation and activate emergency care. Question 30. A nurse reassesses a client after treatment for hypoglycemia. The client's blood glucose is now 102 mg per deciliter, the client is alert, and sweating has stopped. What should the nurse conclude? A. The treatment was successful. B. The client is developing hyperglycemia. C. Emergency glucagon is still required. D. The blood glucose should not be checked again. Correct answer. A. The treatment was successful. Rationale. A normal blood glucose level and resolution of symptoms indicate that hypoglycemia has been corrected. Continued monitoring is still important to prevent recurrence. Strategy. Determine whether the expected outcome has been achieved after an intervention. Improvement in both symptoms and objective findings confirms effective treatment. Question 31. A nurse is caring for a client admitted with diabetic ketoacidosis, DKA. For hours after treatment begins, which finding indicates the client is improving? A. Blood glucose decreases from 520 mg per deciliter to 240 mg per deciliter. B. Respirations become slower, and the client becomes difficult to arouse. C. Urine output stops. D. Blood pressure drops to 78/40 mm of mercury. Correct answer. A. Blood glucose decreases from 520 mg per deciliter to 240 mg per deciliter. Rationale. A gradual decrease in blood glucose indicates that insulin therapy is working effectively. Continued monitoring is necessary until metabolic abnormalities are corrected. Strategy. Compare the client's condition before and after treatment. Improvement in objective findings usually reflects successful therapy. Question 32. A nurse is assessing 4 clients. Which client should be seen first? A. A client with a blood pressure of 150/90 mmHg and no symptoms. B. A client with a temperature of 38.3 degrees Celsius 101 degrees Fahrenheit. C. A client who suddenly becomes confused after receiving opioid medication. D. A client requesting assistance with bathing. Correct answer. C. A client who suddenly becomes confused after receiving opioid medication. Rationale. Sudden confusion after opioid administration may indicate respiratory depression or decreased oxygenation. This client is at immediate risk for deterioration. Strategy. Prioritize unexpected changes in mental status. Sudden neurological changes require prompt assessment. Question 33. A nurse is caring for a client with severe burns. Which assessment finding requires immediate intervention? A. Urine output of 15 milliliters per hour. B. Mild pain at the burn site. C. Temperature of 37.3 degrees Celsius 99.1 degrees Fahrenheit. D. Dry lips. Correct answer. A. Urine output of 15 milliliters per hour. Rationale. Low urine output suggests inadequate kidney perfusion and insufficient fluid replacement. Immediate intervention is needed to prevent organ damage. Strategy. Monitor organ function when caring for critically ill clients. Poor urine output often signals inadequate circulation. Question 34. A client receiving chemotherapy has a white blood cell count of 1/200/mm superscript 3. Which nursing action is the priority? A. Place the client on neutropenic precautions. B. Encourage visitors without restrictions. C. Serve raw fruits and vegetables. D. Administer live vaccines. Correct answer. A. Place the client on neutropenic precautions. Rationale. Severe neutropenia greatly increases the risk of infection. Protective measures help reduce exposure to harmful microorganisms. Strategy: identify laboratory values that increase infection risk. Protect immunocompromised clients from preventable infections. Question 35. A nurse assesses a client with heart failure who reports increasing shortness of breath while resting. Oxygen saturation is 86%. What should the nurse do first? A. Apply oxygen. B. Encourage exercise. C. Offer fluids. D. Document the findings. Correct answer. A. Apply oxygen. Rationale: the client's low oxygen saturation indicates impaired oxygenation. Supplemental oxygen should be provided immediately. Strategy: address breathing problems before completing routine tasks. Stabilizing oxygenation is the first priority. Question 36. A client suddenly develops swelling of the lips and tongue after eating shellfish. Which action should the nurse perform first? A. Assess and maintain the airway. B. Offer ice chips. C. Encourage the client to lie flat. D. Document the reaction. Correct answer. A. Assess and maintain the airway. Rationale: swelling of the lips and tongue may rapidly obstruct the airway. Immediate assessment is necessary to prevent respiratory compromise. Strategy: airway problems always require immediate attention. Early intervention can prevent complete obstruction. Question 37. A nurse is evaluating the effectiveness of antibiotic therapy in a client with pneumonia. Which finding indicates improvement? A. Oxygen saturation increases from 89% to 96%. B. Temperature rises to 40 degrees Celsius 104 degrees Fahrenheit. C. Productive cough becomes bloody. D. Respiratory rate increases to 36 breaths/min. Correct answer. A. Oxygen saturation increases from 89% to 96%. Rationale: improved oxygen saturation indicates better lung function and response to treatment. The remaining findings suggest worsening illness. Strategy: compare assessment findings with expected treatment outcomes. Objective improvement confirms effective therapy. Question 38. A nurse is caring for a client with acute chest pain. Which assessment finding is most concerning? A. Pain radiating to the jaw with diaphoresis. B. Pain relieved by changing position. C. Mild tenderness over the ribs. D. Pain occurring only during coughing. Correct answer. A. Pain radiating to the jaw with diaphoresis. Rationale: these findings are consistent with acute myocardial infarction. Immediate intervention is required to reduce cardiac damage. Strategy: recognize classic symptoms of life-threatening conditions. Prompt action improves patient outcomes. Question 39. A postoperative client suddenly reports severe calf pain, swelling, and warmth in one leg. Which complication should the nurse suspect? A. Deep vein thrombosis. B. Cellulitis. C. Muscle strain. D. Arthritis. Correct answer. A. Deep vein thrombosis. Rationale: unilateral calf pain, warmth, and swelling are common signs of deep vein thrombosis. Early recognition reduces the risk of pulmonary embolism. Strategy: identify postoperative complications early. Localized swelling and pain should never be ignored. Question 40. A nurse reassesses a client after administering 4 fluids for dehydration. Which finding shows the intervention has been effective? A. Blood pressure increases from 86/52 mm of mercury to 112/70 mmHg. B. Heart rate increases from 88 to 128 beats/min. C. Urine output decreases. D. Skin becomes colder. Correct answer. A. Blood pressure increases from 86/52 mm of mercury to 112/70 mmHg. Rationale: improved blood pressure indicates better circulating fluid volume and tissue perfusion. This demonstrates a positive response to 4-fluid therapy. Strategy: evaluate treatment by looking for improvement in vital signs. Stable circulation reflects effective intervention. Question 41. A client receiving morphine reports increasing drowsiness, and respirations decrease to 9 breaths/min. What should the nurse do first? A. Stop the opioid and assess the client. B. Give another dose for pain. C. Encourage sleep. D. Document and reassess later. Correct answer: A. Stop the opioid and assess the client. Rationale: respiratory depression is a serious adverse effect of opioid medications. Prompt assessment prevents further deterioration. Strategy: recognize medication-related emergencies early. Address the cause before additional complications develop. Question 42. A nurse is caring for a client with sepsis whose blood pressure continues to decrease despite fluid resuscitation. Which finding is the nurse most concerned about? A. Blood pressure of 78/44 mm of mercury. B. Temperature of 38 degrees Celsius 100.4 degrees Fahrenheit. C. Heart rate of 96 beats/min. D. Mild fatigue. Correct answer: A. Blood pressure of 78/44 mm of mercury. Rationale: persistent hypotension indicates worsening septic shock and poor organ perfusion. Immediate intervention is required. Strategy: monitor for signs that circulation is failing. Severe hypotension is an emergency. Question 43. A nurse is caring for a client with a suspected bowel obstruction. Which assessment finding requires immediate reporting? A. Absent bowel sounds with severe abdominal distension. B. Mild nausea after eating. C. Passing flatus. D. Soft abdomen without tenderness. Correct answer: A. Absent bowel sounds with severe abdominal distension. Rationale: these findings suggest worsening bowel obstruction that may require emergency treatment. Delayed intervention increases the risk of perforation. Strategy: recognize signs that indicate serious gastrointestinal complications. Severe abdominal changes require prompt evaluation. Question 44. A nurse evaluates a client after administering a bronchodilator. Which finding indicates the medication has been effective? A. Wheezing has decreased, and oxygen saturation is 97%. B. Respiratory distress has increased. C. Accessory muscle use continues to worsen. D. Oxygen saturation decreases to 86%. Correct answer: A. Wheezing has decreased, and oxygen saturation is 97%. Rationale: reduced wheezing and improved oxygen saturation show improved airflow through the lungs. These findings indicate successful treatment. Strategy: assess whether respiratory symptoms improve after intervention. Better oxygenation confirms effectiveness. Question 45. A client with liver disease suddenly becomes confused and difficult to awaken. Which complication should the nurse suspect? A. Hepatic encephalopathy. B. Seasonal allergies. C. Osteoarthritis. D. Gastritis. Correct answer: A. Hepatic encephalopathy. Rationale: mental status changes in a client with liver disease commonly indicate hepatic encephalopathy. Immediate evaluation and treatment are necessary. Strategy: relate changes in neurological status to the client's underlying condition. Unexpected confusion often signals worsening disease. Question 46. A nurse is caring for a client with acute kidney injury. Which laboratory result requires immediate intervention? A. Potassium 6.5 milliequivalent/L. B. Sodium 138 milliequivalent/L. C. Hemoglobin 13G/DL. D. Calcium 9.2 mg per deciliter. Correct answer: A. Potassium 6.5 milliequivalent/L. Rationale: severe hyperkalemia places the client at risk for fatal cardiac dysrhythmias. Rapid treatment is required. Strategy: Prioritize laboratory abnormalities that threaten life. Electrolyte imbalances affecting the heart require urgent action. Question 47. A nurse is caring for a client who suddenly develops severe shortness of breath after removal of a central venous catheter. Which complication should the nurse suspect? A. Air embolism. B. Urinary tract infection. C. Constipation. D. Hypoglycemia. Correct answer. A. Air embolism. Rationale: sudden respiratory distress after central line removal suggests an air embolism. This is a medical emergency. Strategy: consider recent procedures when assessing new symptoms. Procedure-related complications require immediate recognition. Question 48. A client receiving insulin becomes pale, shaky, and confused. Which action should the nurse perform first? A. Check the blood glucose level. B. Encourage exercise. C. Administer long-acting insulin. D. Restrict carbohydrates. Correct answer. A. Check the blood glucose level. Rationale: these symptoms suggest hypoglycemia, which should be confirmed immediately. Assessment guides the next intervention. Strategy: verify the cause of symptoms when it can be done rapidly. Quick assessment helps ensure appropriate treatment. Question 49. A nurse reassesses a client after treatment for pulmonary edema. Which finding indicates improvement? A. Crackles have decreased, and oxygen saturation is 96%. B. Respiratory rate increases to 38 breaths/min. C. The client becomes cyanotic. D. Frothy sputum continues to increase. Correct answer. A. Crackles have decreased, and oxygen saturation is 96%. Rationale: improved breath sounds and oxygen saturation indicate better gas exchange and reduced fluid in the lungs. These findings show that treatment has been effective. Strategy: compare assessment findings before and after interventions. Positive respiratory changes indicate recovery. Question 50. A nurse is evaluating a client after emergency treatment for anaphylaxis. Which assessment finding demonstrates that the interventions were successful? A. The client is breathing comfortably, blood pressure is stable, and swelling has decreased. B. Wheezing becomes louder. C. Blood pressure continues to fall. D. The client develops increasing tongue swelling. Correct answer. A. The client is breathing comfortably, blood pressure is stable, and swelling has decreased. Rationale: stable vital signs, improved breathing, and reduced swelling indicate that the anaphylactic reaction has resolved. Continued monitoring remains important because symptoms can recur. Strategy: evaluate whether the emergency intervention corrected the life-threatening problem. Improvement in airway, breathing, and circulation confirms effective treatment.